Press HD on first, then play, then full screen. Care of people with learning disabilities is particularly important at the moment as it's a national priority, and many PCTs are offering a local enhanced service or LES. You need to be aware of the conditions themselves and the likely associations, where to get help. Realize that psychiatric and physical illness may present atypically, especially as they often have sensory, communication or cognitive difficulties, and you therefore need advanced diagnostic and examination skills. This map has the same structure as all the others. What sort of numbers are we dealing with? There's probably close to 250,000, and they're now in the community as the large mental handicap hospitals are now closed. They either live with their families in residential homes or in supported living environments. What's the definition? Well, the condition needs to have been identified before the age of 18, and they will have an estimated IQ of less than 70, as this actually refers to people with moderate, severe or profound learning disability. They have a significantly reduced ability to understand new and complex information, to learn new skills, in other words impaired intelligence, with a reduced ability to cope independently, impaired social functioning, and with a lasting effect on development. The commonest comorbidities are epilepsy, mental illness, and behavior disorders. The average GP will therefore only have about 8 patients on their books with these sort of conditions. So a rule of thumb for a practice of 3 full-timers would be about 24 patients. There's additional very useful information in this introduction, so please read it. Current strategy is based on the government's white paper Valuing People. Remember, these patients suffer a number of health inequalities, that primary care is now regarded as the main service provider with appropriate support. Health facilitators will often be appointed by local PCTs. They will have their own GP and ideally their own health action plan. They should have an annual health review that includes medication reviews, flu vaccinations, checks of sight and hearing, as well as vigilance for associated conditions that are not part of the primary underlying condition, but which can easily be missed. The Mental Capacity Act is now in force and helps with the financial and welfare arrangements of those who lack the capacity to decide for themselves. Remember, however, that capacity needs to be assessed on a case-by-case basis and on a decision-by-decision basis. As we've already said, a minority of patients in any practice, a significant minority, will have mild learning disabilities that do not need any particular special services but may have problems with reading, writing and comprehension. We're going to focus on those with moderate, severe and profound. Depending on the severity, they may well have withdrawal, challenging behavior, tearfulness, agitation and so on. And similarly, common and important conditions include epilepsy of increased incidence and complexity, sensory impairments, psychiatric problems including emotional and behavioral disorders. Don't forget sexual and physical abuse, the significant mental health problems of schizophrenia, bipolar affective disorder, and increased incidences of dementia in Down syndrome. They may be obese with all its attendant problems, and look for gastrointestinal problems such as swallowing difficulties or reflux, H. pylori, and so on. Susceptibility to chest infections, cerebral palsy, orthopedic problems such as joint contractures and osteoporosis, and skin problems. Drug treatment can be problematic as they may have difficulty understanding instructions. There's a risk they may buy over-the-counter medications which are unsafe. Implementation often depends on carers, and side effects may be difficult to identify. Fortunately, where there are specialist teams, they are often multidisciplinary and include art therapy, chiropodists, dietitians, music therapists, and so on. The proposed health reviews have significant impacts on prevention. One needs to be particularly patient-centered and also remember the needs of the carers, respect the patient's autonomy, use advanced consulting skills and communication aids. Continuity of care is particularly helpful, and have an awareness of the various things such as the Mental Capacity Act, how to assess competence. In assessing mental capacity, is the client able to understand, retain, and assess the information and then communicate the decision? URAC can be used as a mnemonic. Therefore, if they are unable to do any of the above, they are unable to make the decision for themselves. The Office of the Public Guardian has some really good resources on here. The Mental Capacity Act states that up to 2 million people in England and Wales may lack the capacity to make some decisions. They are looked after by about 6 million carers, including professionals, relatives and friends. And the frightening statistic that there will be over 1 million people with dementia by 2025. These media snapshot guides are excellent and are available on the Office of the Public Guardian website. There's also a Mental Capacity Act film. Clicking on the link below will take you to this excellent glossary of terms such as attorney, court of protection, enduring power of attorney and so on. One of the other links will take you to the GMC's website on consent guidance in making decisions about investigation and treatment, whereas the bottom link will take you to the Advanced Directive DirectGov website. In a nutshell, diagnostic overshadowing is where you assume everything is due to the learning disability and not due to a second or often treatable problem. Understand associated problems such as Fragile X syndrome and autistic spectrum disorder. Understand the roles of all forms of carers, voluntary and statutory agencies, and importance of partnership and cooperation. The biopsychosocial and cultural factors are even more important than in non-LD patients. And don't forget the important areas of context, attitude and science in making sure that people are managed optimally. Remember, when it comes to diagnostic overshadowing, that when a person presents with a new behavior or an existing one escalates, consider physical problems such as pain or discomfort, toothaches, ear infections, constipation, reflux, deteriorations in vision or hearing, possible psychiatric causes such as depression, anxiety and so on, or social causes such as changes in carers, bereavement or abuse. The websites here are particularly useful with definitions and classifications of learning disabilities from Newcastle University. Mind's excellent resources on understanding learning disabilities, their info lines, fact sheets and booklets. These links take you to financial support for the disabled, NHS evidence page on learning disabilities. Don't forget that Turning Point deals not just with people with drugs and alcohol, but anyone with complex needs, including those with learning disability. I've also recently added this excellent LES guidance from NHS Employed, which summarizes lots of areas beautifully, including the background and purpose of the audit requirements for learning disability health check schemes, advice on setting up the register, the codes you can use for multi-professional education sessions in order to be able to deliver this LES, the importance of overcoming barriers, whether they be communication, physical, social, cognitive, values and attitudes, both amongst the healthcare professionals and the individuals trying to help, the role of the community learning disability team and other support networks, experiences and expectations, the DDA and something I'd not heard of, the disability equality duty. Resources may be available locally. What needs to be covered in the health checks, including a review of the physical and mental health with referral through the usual practice routes if health problems are identified, health promotion, chronic illness and systems inquiries, a physical examination, a look at any epilepsy, behavioral and mental health problems, medication review, coordination arrangements for secondary care, and a review of transition arrangements. You can access the Cardiff Health Check Protocol, the gold standard, via the RCGP website, or you may have your own protocols. There is now a new and preferred code, 69DB. Learning Disability Health Examination. That more detailed overview was to enable people to get a good handle on a new and developing area.